AI could save healthcare $360 billion. So why are your bills still rising? AI documentary. In 2016, one of the world's most respected AI researchers made a prediction that stunned the medical industry. Geoffrey Hinton, the scientist often called the godfather of artificial intelligence, told a room full of doctors something almost unthinkable: stop training radiologists. AI, he argued, would soon outperform humans at reading medical scans. The machines would take over. The profession would slowly disappear. 9 years later, the exact opposite happened. Radiology became one of the highest-paid specialties in America. Average compensation climbed above $500,000 annually. Hospitals still cannot hire enough radiologists to meet demand. So what happened? Why did one of the most famous AI predictions in healthcare fail so completely? And if artificial intelligence is already capable of saving the healthcare system hundreds of billions of dollars, why do patients still feel like every hospital visit costs more than the last one? The reason Hinton's prediction failed reveals something important about AI itself. Artificial intelligence is exceptionally good at narrow pattern recognition. Give it millions of scans focused on a specific condition, and it can become remarkably accurate. Certain cancers, specific fractures, some retinal diseases. On standardized benchmarks, some AI systems already match or outperform individual radiologists under controlled conditions. But hospitals are not controlled conditions. Real patients arrive with incomplete histories, unusual symptoms, rare diseases, unexpected complications. The scan itself is often only one piece of a much larger clinical puzzle, and that is where AI performance becomes less predictable. A model trained on one hospital's equipment may perform differently in another system. A model trained for one abnormality may miss something entirely unrelated. The edge cases, the strange cases, remain deeply human territory. Then there is the legal reality. Who carries liability if an AI system misses a tumor? The software company? The hospital? The radiologist who trusted the software? The technology advanced faster than the legal framework surrounding it. So hospitals adopted AI carefully, not as a replacement for radiologists, as an amplifier for them. Which meant something unexpected happened. AI increased the productivity of radiologists while demand for imaging continued exploding. The specialists became more valuable, not less. But while the public focused on AI diagnosing disease, hospitals discovered something else entirely. The fastest financial returns were not coming from medicine, they were coming from billing. Today, roughly 75% of hospitals developing AI strategies are prioritizing revenue cycle management, not treatment, not diagnosis, not reducing patient costs. Revenue cycle management. That means insurance claims, billing optimization, prior authorization, collections, payment processing, the financial machinery underneath modern healthcare. And economically, the logic is obvious. A hospital using AI to process insurance claims faster improves cash flow almost immediately. A hospital using AI to reduce unnecessary procedures may reduce its own revenue. That distinction changes the entire story, because suddenly the question is no longer, what can AI improve? The question becomes, what does the system financially reward AI for improving first? One estimate projected nearly $10 billion in savings from AI-powered revenue cycle automation alone. Not savings for patients, savings for hospital operations. The easiest healthcare problem for AI to solve turned out to be getting hospitals paid faster. In 2023, researchers from Harvard and McKinsey published one of the most important healthcare AI studies in the world. Their conclusion was extraordinary. Artificial intelligence could eventually save the American healthcare system up to $360 billion annually. $360 billion, without reducing quality of care. The technology exists, the efficiency exists. But buried underneath the headline was a far more important finding. The biggest barrier was not technological, it was structural. American healthcare operates inside a system where many institutions make money from complexity itself. Hospitals earn revenue from procedures, testing, imaging, admissions. Insurance companies earn margins from administering enormous flows of healthcare spending. And that creates an uncomfortable reality. Some of the AI systems capable of reducing overall healthcare costs most aggressively may also reduce revenue for the institutions deploying them. An AI system that prevents unnecessary imaging can save the healthcare system money, but it may also reduce imaging revenue for the hospital. An AI system that reduces avoidable procedures can lower national healthcare spending, but it may simultaneously reduce hospital income. The incentives become conflicted. The technology that could save the system the most money may be the technology the system has the weakest financial incentive to deploy broadly. And that may explain why healthcare AI is improving administrative efficiency faster than patient affordability. There is another problem developing underneath the healthcare AI boom, and it may become one of the most dangerous consequences of all. AI systems require enormous amounts of patient data. The more data they process, the more accurate they become. Which means healthcare organizations increasingly share sensitive patient information across sprawling networks of software vendors, analytics firms, cloud providers, and AI platforms. In 2020, healthcare data breaches affected approximately 27 million individuals. By 2024, that number rose to more than 250 million, nearly 10 times higher in 4 years. And many breaches did not originate from hospitals themselves. They came from third-party vendors prompting. The same ecosystem helping healthcare AI scale is also concentrating some of the most sensitive personal information on Earth into increasingly interconnected systems. Medical histories, diagnoses, prescriptions, mental health records, insurance disputes. The future AI economy may be built partly on the most private information people possess, and most patients have almost no visibility into where that data travels once it leaves the hospital. The radiologists did not disappear, but many healthcare workers underneath them are beginning to. Medical coders, billing specialists, transcriptionists, prior authorization staff, the administrative layer connecting hospitals, insurers, and patients. These jobs rarely appear in public conversations about AI disruption, but they represent hundreds of thousands of careers spread across cities, suburbs, and rural communities throughout America. A medical billing specialist may spend 20 years mastering an extraordinarily complicated insurance system, only to watch software automate large portions of that work in seconds. And unlike physicians, many of these workers do not have elite credentials or massive salaries protecting them from displacement. Administrative complexity consumes roughly 30% of American healthcare spending. That complexity became one of AI's first targets. The expensive layer above remained protected. The layer underneath started shrinking first. The same pattern we have now seen across law, retail, and customer service. The healthcare AI story did not unfold the way many people expected. AI did not suddenly replace doctors. Hospitals did not become dramatically cheaper. Medical bills did not collapse. Instead, the technology entered an already complicated system and adapted itself to the incentives already inside it. Hospitals invested heavily in AI that improved revenue operations. Insurers invested heavily in AI that optimized claims management. Administrative workers absorbed much of the early displacement. And the hundreds of billions in theoretical savings identified by researchers remain trapped inside a healthcare system not structurally designed to return efficiency gains directly to patients. That may become one of the defining realities of the AI economy. Efficiency alone does not determine who benefits from technological change. Incentives do. And in healthcare, the institutions adopting AI most aggressively may not always be financially rewarded for making care cheaper. They may be rewarded first for making the system run faster. Next on Disruption Files, Wall Street, where artificial intelligence is beginning to approve loans, manage portfolios, detect fraud, and influence financial markets at speeds human analysts cannot match, and why some regulators are starting to worry about what happens when entire financial systems begin reacting to the same algorithms at the same time.